The first week of school is wrapping up in Arkansas, and so far we have not seen a COVID-19 outbreak on a campus in the state. That's according to health officials. What we are seeing is more spikes in new cases statewide. After several days of what appeared to be downward trends in our cases and our hospitalizations, the state reported the biggest one-day jump in new infections since the beginning of January. 3,549 new cases of COVID-19 were reported yesterday. That jump brought our total active cases to close to 25,000. Of that number, 1,410 are battling the virus from a hospital. That is 38 more than Wednesday's total, and the first since Monday we've seen it go up. Another 16 people have died from complications of COVID-19. That brings the state's total to 6,581 lives lost. A viewer reached out to us asking if we could highlight the amount of unvaccinated people that make up those numbers, so here you go. 84% of our active cases are people who are not vaccinated. Since February, unvaccinated individuals have accounted for 89% of our total cases, 91% of our hospitalizations, and 89% of our deaths. Nationally, COVID-19 is driving up hospital admissions for people under the age of 50, and the CDC says admissions are at the highest level since the start of the pandemic. 3 U.S. senators say they're among those testing positive even though they're fully vaccinated. They credit the vaccine with preventing severe symptoms. Breakthrough cases like those are one reason the White House is recommending booster shots after seeing evidence overseas of worsening breakthrough infections.
Our plan now is to get ahead of that. We don't want to start to see that in this country.
Adding to the concern about how easily the Delta variant is spreading among everyone, according to an Oxford University study, fully vaccinated people with breakthrough infections from Delta variant carry a similar amount of the virus as those who are unvaccinated and infected. We're getting a lot of questions about COVID booster shots now that federal health officials are recommending we all get one. A lot of people are wondering why they have to wait 8 months after their second dose to get the extra shot. Matt Gregory went to experts to verify.
It's all about keeping that protection as high as possible. We know that the best thing to protect you from the virus is the vaccine, but medical experts have started to notice that protection starts to weaken after 6 months. And this is a way to stay ahead of it, especially as those stronger variants keep popping up. Why is the federal government recommending booster shots after 8 months? Our sources are the U.S. Surgeon General Dr. Vivek Murthy, Dr. Anthony Fauci, CDC Director Dr. Rochelle Walensky, and these 3 studies. Throughout the pandemic, health officials have monitored the level of protection the vaccines offer.
Data we're seeing from our international colleagues, specifically and especially Israel, have demonstrated a worsening of infections amongst vaccinated people over time.
But, and listen closely, that number of infections did not increase near the level it does for unvaccinated people. Still, health officials believe booster shots would offer more protection over time. When asked why we need them 8 months after the second dose, here's what the Surgeon General said.
We did see that around the 6-month mark in the data, you start to see increases in mild to moderate infection.
According to the experts, immunity doesn't fall off in 6 months or even 8 months, but the goal from here on out in the pandemic is to stay ahead of the virus.
If you wait for something bad to happen before you respond to it, you find yourselves, you're considerably behind your real full capability of being response.
While the CDC made that recommendation, the FDA has still yet to approve the booster shots, but we expect them to make that announcement sometime soon. At the same time, the recommendation does not apply to Johnson & Johnson vaccines. Health experts are still gathering data to make a recommendation on the J&J vaccine. With your Verify, I'm Matt Gregory.
President Joe Biden is expected to address the nation any moment about the ongoing situation in Afghanistan. We're going to be carrying that right here on the air. The Pentagon says the U.S. has evacuated approximately 5,700 people out of Afghanistan in the last 24 hours. But now flights are temporarily on hold because the processing facilities in Qatar are overwhelmed. Critics say the Biden administration should have been better prepared to evacuate Americans and Afghan allies when it announced the withdrawal of U.S. forces. The Wall Street Journal published a State Department memo from July 13th in which diplomats warned the Afghan government could collapse after the U.S. troop withdrawal. And they urged the department to start pulling Americans out of the country before the troops were gone. Meanwhile, members of Congress are getting an unclassified briefing on Afghanistan today. Lawmakers say they will hold hearings looking into what went wrong. As the crisis in Afghanistan continues, Governor Asa Hutchinson says he's open to offering asylum to refugees. The governor kicked off his weekly press conference yesterday with his thoughts on the situation. He says Arkansas understands America is responsible for those families that supported U.S. troops and would welcome those people that need a place of refuge. And the governor is not alone.
Canopy Northwest Arkansas is Arkansas's only resettlement agency that is actively resettling refugees at this time. So that includes people from Afghanistan who are special immigrant visa holders, individuals who have supported our troops, who have supported our media agencies, our NGOs on the ground.
Though the Afghan community in Northwest Arkansas is small, Canopy welcomes them with open arms. The resettlement agency will provide housing, job resources, benefits, public services, and school enrollment. Veterans across the country who served in Afghanistan are experiencing many emotions since the fall of Kabul. The Veterans Crisis Hotline says it is seeing more calls from those feeling the impact. Deborah Alfarone has more on how we can talk to loved ones who might be struggling.
Jeff Hurley enlisted in the Army a few months before the September 11th attacks and served until 2013. He says he feels America let down the people of Afghanistan.
We have absolutely and completely abandoned the Afghan people. The people that speak to your heart, those that can't fight themselves, the women, the children.
Dr. Caitlin Thompson with Cohen Veterans Network says veterans experiencing a range of emotions are reaching out in numbers.
Grief and anger, a lot of sadness, there's a lot of fear, anxiety. There's also some fear that they failed their mission, and they're concerned that people are also looking at them and thinking, you know, what did you do this whole time, which I think is devastating.
The Department of Defense is reminding veterans what is happening now does not minimize or negate their service. The DoD is also encouraging veterans to take advantage of mental health resources.
If you do have a veteran or a military family member, just say, hey, I just want to acknowledge that things must be really hard in terms of how you're doing right now. And I am here for you, and I'm ready to talk anytime you are, and I can help find resources if you need them.
Just really feel, for the Afghan people.
Retired Sergeant Major John Plassey served 2 tours in Afghanistan. He encourages those struggling to reach out.
So maybe they're in their mind thinking, I'm going to give up too. Well, please don't do that. Please reach out. Please seek help, and it's not a sign of weakness by any means, it's a sign of strength.
And mental health professionals want veterans to know they are not alone in what they're feeling. Deborah Alfarone, CBS News.